Hi, my name is Darren Chandler from GoToImaging.com, and today's video is called Don't Fall Onto Your Bum. Why? Because you can incur potentially an excruciating condition called coccydynia. Now, you may or may not have ever experienced it, or you know of someone who's experienced it, but when you fall onto your buttock, the final joint at the bottom of your spine, the tailbone, which is known as your coccyx, can sometimes be traumatized in such a way that it shears forwards off its base, or it can sort of dislocate fully. And you may or may not know of people that have sort of bought rubber rings, or in the offices when they're sitting down, their main kind of area of buttock is sitting on the ring, and so it just means the tailbone itself doesn't sit on anything, i.e. weight bearing, which will then cause irritation of the joint where it has kind of bent forward. So I'm just going to show you a couple of cases of this, and so you all understand what is coccydynia. Where are we? Here we are. Okay, I want you to look at this image just here on the right hand side. So here we have a patient who came to see me with terrible sort of low down sort of buttock coccyx area pain, and you can clearly see that when you travel down, there's the S1 bone just there. When you travel down the sacrum and you come to the coccyx at the base here, can you see here the final distal bone has slightly shifted forward, and that creates an incongruency at that segment. So when the patient sits, a lot of their pressure goes into this corner just here. It becomes inflamed, and it's very, very painful. And they generally will do anything to put it right, because obviously we spend half our life sitting, so it can be quite excruciating. Here's another patient here. Now, this is a very interesting case. This was a lady who came to see me who was in severe pain from falling. And if you count down again here, so here's the S1 bone, 2, 3, 4, 5, all the way down, we come to the coccyx. Can you see if I blow this up here, that the final little part has completely sheared off. So we have two bones here, and you can see it should be attached and come down here, but it's completely dislocated off. And that was, again, due to a trauma where the lady fell and landed onto her buttocks, and it completely sheared off. So very, very painful condition. If you know of anyone who's suffering with it, or you've had it and you'd like to find out more, go to GoToImaging.com, and we talk about it on our case history studies. Or if you're just a member of the public who's currently suffering with it and you'd like to have some treatment or know more about what's the sort of best direction to go to, then you may want to get in contact with spineplus.co.uk. But whatever you do, don't get drunk. Don't accidentally fall, because if you do, you may end up with a subluxation or a complete shearing of the coccyx. Take care.